Now let's move on to the other type of parasite known as helminths or worms. These are multicellular parasites that can cause a particular reaction in the white blood cell count. Can you tell me what particular cell line is increased with invasive helminth infections? Helminthic infections cause eosinophilia. The mechanism of eosinophilia is by stimulation of a T helper cell type 2-like response with the production of IL-4 and IL-5, generating IgE secreting plasma cells, and that causes an increase in the number of eosinophils. The level of eosinophilia actually mirrors the magnitude of tissue invasion by the helminths. There are 3 types of helminths: nematodes, which are roundworms, and 2 types of flatworms, namely cestodes or tapeworms and trematodes, also known as flukes. Let's start with nematodes, which we've broken down into those that cause intestinal infections and those causing tissue infections. Enterobius vermicularis, also known as pinworm, is a small nematode about 1 centimeter long. Enterobius infection is the most common helminth infection of the United States, which means one thing: it's really likely to show up on your boards. Here's a micrograph just to show you what they look like. You might see this on your exam as a part of a question stem. Transmission is via fecal-oral transmission, and these eggs tend to hatch into the larvae in the intestines. The larvae then mature into adults, mate, and then adult females are going to migrate down and out of the anus where they lay the eggs in the perianal skin. Hey, can you recall the very typical symptom that patients often present with? They will always give you this clue on your board exams. These perianal eggs are responsible for an intense perianal itching seen in infected hosts. So they're really very commonly going to describe a child who has extreme perianal pruritus. And children who engage in thumb sucking will consume these eggs again and further continue that fecal-oral cycle. Pinworms most commonly affect children and can be diagnosed using a very peculiar test. Can you remember the name of that test? Well, it's called the Scotch tape test, and think about that for just a second. A piece of tape is pressed against the perianal skin and then examined under a microscope for eggs. Not exactly the most pleasant test in the world, right? But don't forget this one. Treatment is with mebendazole, or any of the bendazole drugs. You will notice that all of the worms causing intestinal infections can be treated with this family of drugs. The mnemonic that worms are bendy may help you remember that you treat them with bendazoles. Ascaris lumbricoides is also known as the giant roundworm because it can grow to be 13 inches long, as you can see in this photo. It is the most common helminthic infection in the world, especially in tropical areas of the world with poor sanitation. Similar to enterobius, transmission is via fecal-oral ingestion of eggs from contaminated soil. The eggs will hatch in the digestive tract, and larvae penetrate the intestinal wall where they enter the bloodstream. From the bloodstream, then they travel to the lungs where they can cause pneumonitis. Amazingly, the larva then migrates out of the lungs up into the trachea, then down into the esophagus and into the GI tract where they mature into adults. Quite a trek, really. Although most infections are asymptomatic, if a lot of these little worms pile up in the intestines, they can cause a particular disturbance. Can you think of what sort of problem might arise? Actually, intestinal obstruction can occur when large numbers of worms are in the GI tract. The adult worms live in the lumen and do not penetrate the GI tract mucosa. Strongyloides stercoralis infections occur when larvae in contaminated soil penetrate through the skin. Note that this is a different form of transmission than the other nematodes we've discussed so far. So the S in strongyloides for skin. This usually occurs through the feet when someone's walking around barefoot. Here's an H&E stain of strongyloides taken from smooth muscle biopsy. I'm showing you this so you can get used to what these worms look like on your exam. You probably won't be expected to make the diagnosis just from an image. You'll pretty much always be given a very classic history to help you. From the site of entry, larvae migrate through the blood to the lungs, again up into the trachea and down the esophagus into the GI tract. Hey, what was the name of the nematode we just described a couple minutes ago that does the same exact thing? The answer, Ascaris lumbricoides. In the GI tract, they will mature and then mate, and females will lay their eggs within the actual intestinal wall. The presence of these eggs can cause intense abdominal pain, diarrhea, vomiting, and even mild anemia. Today, diagnosis is usually made by serologic evidence, which has a high sensitivity and specificity. But traditionally, you can also make this diagnosis by visualizing larvae in the stool. Note that diagnosis of other intestinal helminths is usually made by seeing eggs and not larvae in the stool. Ankylostoma duodenale and Necator americanus are known as hookworms because they have a very characteristic hook in their mouth that allows them to attach to intestinal mucosa, which you can see here. Note the jagged appearance of the mouth. Just like strongyloides, larvae of the two hookworms are found in contaminated soil and penetrate into human skin, usually through the feet. But unlike strongyloides, where you will find larvae in the stool, with hookworms you'll find eggs in the stool. So once these little worms end up in the intestinal tract, they're going to latch onto your intestinal mucosa, as you can see here. Now, just like you can probably imagine, this might be a little bit traumatic and may even cause a little bit of bleeding. So, what sort of lab changes might you expect to see on a complete blood count, a CBC? Well, you'll see anemia. Hold up. Hematology coming at you, stat. What kind of anemia are you going to see from a slow, insidious GI bleed? Will it be microcytic, macrocytic, or normocytic? The answer is microcytic because it causes an iron deficiency. Hang on a second, let's take one step back. What do you mean by microcytic anemia? What lab value is used to define this? The MCV, or mean corpuscular volume, is a measure of red blood cell size. MCV less than 80 is usually the cutoff for microcytic anemia. Okay, great. What are some other causes of microcytic anemia? Well, the most commonly tested ones would be thalassemia, of which you have thalassemia alpha and thalassemia beta, most commonly asked. You also have sideroblastic anemia and lead poisoning, Pb being the symbol for lead. Awesome. How about macrocytic anemia? How do we define that? Well, that's typically defined with an MCV greater than 100. And what are the two most commonly tested causes of macrocytic anemia? Well, that would be vitamin B12 and folate deficiency. Cool, so they both cause macrocytic anemia. But what is the one key difference between them that you must know? One affects the neurological system. Okay, so our patient presents with a macrocytic anemia. Let's say his MCV is 106. He's got decreased vibration sense and sensation to light touch in the fingertips. So what's the deficiency? Vitamin B12. You guys are going to be hematology all-stars. One more integration here. I can't just sit here and let this one go by. We have to give the GI system some love too. What's the name of the gastrointestinal disease that causes megaloblastic anemia? It's called pernicious anemia. And can you remember the reason it causes vitamin B12 deficiency? Well, it's an autoimmune disorder where autoantibodies affect a particular cell type in the stomach. And what type of cell is that? Those would be parietal cells. Great. And why is that important? Think back to your GI physiology and how B12 is absorbed. What product of the parietal cells is required for B12 absorption in the small intestine? That would be intrinsic factor. By the way, what part of the GI tract is B12 absorbed in? That would be the terminal ileum. And what about folate? That would be the jejunum. And finally, iron? That's the duodenum. Boom. An intestinal infection as well as microcytic anemia can occur as the adult worms attach their hooks to the intestinal mucosa and feed off the host's blood. Next are the nematodes causing tissue infections. Loa loa, Onchocerca, and Wuchereria bancrofti. These are probably a little bit less likely to show up on your exam, so we're not going to spend a whole lot of time talking about them, but I'll give you the key pointers for each one. The one thing you might see on your exam about Loa loa, seen here, is the fact that it can be found migrating through the conjunctiva. So if you see that on your test and a reference to a worm in the conjunctiva, think Loa loa. Onchocerca volvulus, seen here, causes river blindness. It is called river blindness because these infections are usually endemic to areas near bodies of water. If the worm migrates into the eyes, it causes blindness. Treat with ivermectin, and the way I like to remember ivermectin is that you use it to treat river blindness. Wuchereria bancrofti invades and obstructs the lymphatic system and causes lymphedema, sometimes called elephantiasis, which you can see here. Treat this one as well as loa loa with diethylcarbamazine. Toxocara canis is similar to Ascaris lumbricoides, but it can only complete its life cycle in dogs, hence the word canis in the name. Therefore, transmission is via ingestion of eggs in soil contaminated with dog feces. As seen here, the eggs hatch and larvae emerge, which then penetrate the intestinal wall. So here's the egg, here's the larva hatching out. Just as we described with Ascaris lumbricoides, these are going to penetrate the intestinal wall. The larvae then enter the bloodstream and migrate to very different organs, causing diseases known as visceral larva migrans. Involvement of the eyes can lead to blindness. Now that we've finished going over the worms, let's make sure you can remember them, since there were quite a few. There are two great mnemonics to help you remember how some of the nematodes enter our bodies. Enterobius, Ascaris, and Toxocara are ingested and form the word eat. Strongyloides, Ankylostoma, and Necator enter our bodies by penetrating through our skin, usually through the feet. They form the first three letters of the word sand. Before moving on, let's take a quick moment to discuss one more nematode that actually isn't in your book, but I think is really important to know about since it's really likely to show up on your exam. Trichinella spiralis causes trichinosis. Question: what is a very common way that the boards will present trichinosis to you? Well, how do you get infected with trichinosis? Remember that it is often transmitted in undercooked pork, so your patient might be a pig farmer or an avid barbecuer of pork even. Once ingested, larvae mature in the digestive tract, penetrate the intestinal wall, and then they enter the bloodstream. Now the place that they really like to go is to the muscle. Remember this because diagnosis is confirmed by muscle biopsy. Here's an H&E stain from a muscle biopsy showing encysted organisms within the muscle tissue. And there they are right there. Again, a little smiley face for you here. And here's another image showing something very similar, with trichinella cysts appearing within striated skeletal muscle. You can see here, 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 all over the place. In addition to GI symptoms such as nausea, vomiting, and diarrhea, you may also see high fever, eosinophilia, and a very particular finding in the head and neck region. Do you remember what that is? You will absolutely see this in your question stem, so don't forget that periorbital edema occurs as the migrating larvae reach peripheral tissues. Flash quiz. A 3-year-old child is brought to your office. His mother states that he has been scratching his perianal area with unusual frequency. I don't know what a usual frequency is for a 3-year-old to scratch their perianal area, but this kiddo, he's going a little crazy. Unusually frequent. What diagnostic test do you order? You're going to want to order the Scotch tape test to look for the eggs, and the responsible nematode, of course, Enterobius vermicularis.